Fieldwork is challenging for a lot of reasons, not the least of which is because sometimes you see things that are a little bit different from what you expect or maybe from what you learned about in school. So it can be challenging handling those situations. And I have addressed some of these situations as a former fieldwork educator and a director of clinical education. So I think my best advice to students that are about to experience fieldwork for the first time would be to constantly practice good communication skills. Many times I would have students call me or email me and say, I think I have an ethical situation going on. And my students weren't really understanding what a true ethical issue was. And what they're seeing maybe was an example of something that was perhaps less than best practice. So they had to learn what ethical issues are and then how to address situations if it is less than best practice. So that requires someone to be very well informed, so understanding our code of ethics and our values statement. Also having really good communication skills and being able to talk to someone in advance about what they're seeing. Another issue that frequently comes up that would fall under the category of professional issues or professional behaviors. And again, I can't emphasize enough the importance of good communication. So finding out from the beginning what the expectations are for professionalism, of course for clinical competence, but for all of those ambiguous or somewhat nuanced issues of professionalism, what are the specific expectations? And then checking in frequently with your fieldwork educator to find out if you're meeting those expectations, and if an issue should arise, communicating in a professional manner proactively about the situation. So the 2 points, I guess, takeaway points would be very well informed, know your Practice Act, know your code of ethics, know what the expectations are for your facility, and then communicating open, honest, early, proactive communication. I think you're going to be great.